Hi, Dr. Kevin Windisch from Sparks Pediatric and Adolescent Medicine again. Welcome to our video series for parents. Today we're talking about asthma and how you diagnose it and what it is. I hope that these videos can help to answer your questions. If you think your child has asthma, however, he or she needs to be seen by a physician. We're happy to see you in our office at area code 775-359-7111. We'll get you in same day. Please don't call my office with questions. We need to see the patient in order to be able to answer any questions that you have. So what is asthma? Asthma is inflammation of the airways or swelling of the smaller airways of the lungs. It can be caused by any of a number of things, and exactly how that happens isn't well worked out. But allergies and respiratory illnesses in particular can drive it. So can cold air. In some patients it just happens. In addition to the swelling, sometimes the airways kind of constrict themselves or tighten themselves up. And we can use medications to reverse both the swelling and the constriction. The constriction is easy to reverse. The swelling is more difficult and takes longer to fix. And the swelling is what can make asthma such a dangerous disease. Please remember, asthma is a potentially fatal disease for patients of all ages. It needs to be taken seriously. It needs to be treated aggressively. Please don't take your children off of any preventer medicines without talking to your physician first, because a bad asthma flare can land you in the hospital or worse. So how do we diagnose it? It depends on the age of the child. If the child is older, we can do what's called spirometry, where we have them blow into a special tube and measure airflow and look for signs of obstruction in the lungs. If we don't see any obstruction, we can exercise the child or give them medicine to inhale called methacholine, and then repeat the study and look for obstruction in the lungs. And if we see it, we have our diagnosis. However, you need a child to be at least 4 or 5 years of age to be able to do that. And in many cases and in many centers, you need the children to be as old as age 7. It's very effort dependent, and the child has to be able to take instructions. So for most patients, asthma is diagnosed based off history and physical findings. Realize that most young children under about age 3 don't wheeze a whole lot with their asthma. So if you or your physician are concerned that there's no wheezing when the child is coughing and think, well, gee, that can't be asthma because there's no wheezing. Most children don't wheeze at this age, so it's easy to underdiagnose asthma, and I see it underdiagnosed all the time. So what diagnostic criteria do we use? Well, mostly it's recurrent cough, especially recurrent cough that lasts for more than 2 weeks. Especially if every time you get a cold, it goes to your chest. That's asthma. Asthma is more common in children under age 2, so it's the younger kids who are more likely to have it. Many of them outgrow a lot of their symptoms as they get older. And I hear this time and time again. Well, I heard he can't have asthma because he's 2 years old. I heard you can't diagnose it under 2 years of age. I even had one parent tell me, I heard it's illegal to diagnose it under 2 years of age. No, in fact, those are the kids that are more likely to have asthma. Well, they might outgrow it. They may not have it as an adult, but they have it now and it needs to be treated. Yeah, the symptoms are vague and the history can be fuzzy. But it's important to be aggressive and to treat it and to manage it and to prevent it. Because if you don't, again, it has a mortality rate, a death rate associated with it that has been steadily increasing since 1972. And we don't want your child to be one of those statistics. If you think your child has asthma and needs to be diagnosed, if you think you're not being managed, if you have questions about asthma and your child, give us a call. We're happy to see you in our office, area code 775-359-7111. I hope this has been of value for you, and we'll see you next time.